Welcome to this session of the Rehab Tech Summit Neuro Edition. We're here today with my co-host of the No Stroke podcast. We're also sponsoring this session. I'm very happy to be here today, bringing you this session entitled Tackling Digital Transformation in Rehab. We have to build a case for the team coaching approach. So welcome, Mike. That's a big ask. I think we're up for it.
Absolutely. Yeah. Glad to be here. Thanks everyone for hanging out for this evening edition on the East Coast. Pacific is still an early afternoon. I have to get my time zones right. And for anyone else outside of the US, again, thank you for joining us. Yeah, really excited for this one. Bit of background. So as David alluded to, we are the co-hosts on the No Stroke podcast. So No Stroke podcast launched about a year ago to date, and David and I have connected through the pandemic, really with a mutual drive and passion to support stroke survivors through kind of this changing landscape that we're in with healthcare. So David brings strong background as a physical therapist, which I'll let him kind of dive into a bit as well. And my background is in product. I'm currently a product manager for CVS Health. Worked on a few health coaching products when I was in Ireland. But really the root of the No Stroke podcast started with my why. And my why is after growing up as a stroke survivor to my mother, who suffered a stroke at the age of 28. I was about 6 weeks old at the time. She yelled at me the other day. We were on one of our podcasts. I said I was 6 months old, and she was like, "Damn it, 6 months and 6 weeks is a big difference. All right, make sure you get it right the next time." So I'm getting it right this time on. But yeah, David and I have been on a fun adventure here for about 2 years, really trying to grow this community, really to focus on the pain points, both from a clinical lens and a patient perspective. So Dave, why don't you kind of give the audience a bit of background, obviously with yourself and who we've really been talking to, and the key theme that a lot of the conversations that we've had on the podcast, which drove us to the session today.
Yeah, thank you, Mike. And yeah, so my name is Dave Dansero. I've been going into my 16th year after surviving a stroke myself. I realized after doing much of my rehab at home with 3 young children, all under the ages of 10, I realized just how disconnected the pathways are and the experiences are for stroke survivors. And that caused me to be very, very much empowered, because as a physical therapist, I had the tools and was fortunate to be able to connect and kind of hack some of my own recovery. At home, I realized there were a lot of survivors that weren't so fortunate. And it's been sort of a mission, and now a joint mission, having been very fortunate to connect with my co-host here, Mike Garrow, that we have teamed up and really, are really trying to move the needle on connecting care. And we're bringing into the discussion today 2 great guests that I really feel we've had them on individually as guests on our podcast, and I really feel they'll help us to lend a lens to this discussion around the importance of having a connected approach that involves coaching. Mike, you and I, we've talked many times about validations are happening in other areas around digital tools to combat and improve things like chronic disease management, musculoskeletal care, but we haven't really moved the needle all that much on stroke care. So I think it's part of our mission today to kind of dive into that topic.
Absolutely. So really our focus lies today are with 2 great guests. First, Marina Borukhovich, who is the CEO, co-founder of YourCoach.Health. Really what they're in the platform you'll see Marina speak to here shortly is bringing this to scale for the health coaching population and driving evidence and reimbursement behind it as well. So it's super exciting stuff. And then we'll be speaking, within this conversation as well with Dr. Carolyn Brown, founder of Stroke OT. So I think that what we're going to be drawing to, and hopefully, when we sit down for the roundtable portion, once they finish their presentations, is really to think about where the disconjoint happens through care, and how, community as well as technology could kind of bring these pieces together. And as Marina, and I have talked about this before, it's really trying to do this, powering technology into healthcare, but we need that human touch behind it, right? So how do we think about that as we, try to bring this revolution into healthcare? So without further ado, let's first bring on our guests. So we'll be jumping into two presentations from Marina and then Carolyn, and then we'll sit back down for our discussion. So really hope you enjoy this one. And for folks who want to catch us on the podcast, you could find us at No Stroke, KNOW Stroke, on your favorite podcast player. So thank you.
Thank you. Let's bring our guests in.
And thank you. So now we're going to be moving to our keynote section of this discussion, and we're honored to first bring to the stage Marina Borukhovich, CEO of YourCoach.Health. Take it away, Marina.
Thanks, Mike. Hi, everyone. Good to be here. I'm just going to quickly share my screen here, and we can get started. Hi. So again, my name is Marina Borukhovich. I'm the CEO and founder of YourCoach.Health. And before we go into what the company does, I always like to do a brief introduction and talk about the company, but I always want to talk, I also want to introduce myself because, and I say this all the time, people work with people, people don't work with logos. And I feel that it's really important for you to get to know me, what I'm about, what the DNA of YourCoach is all about, and why we do what we do. So my story got started about 7 years ago, my story into health and wellness. And that was when I was diagnosed with breast cancer at the age of 37. So going through my journey, I realized what was missing. So besides the wonderful medical care that I was getting, it was the whole holistic approach to my body and soul. And that's the part that was missing for me. Also at that point, we're living in Europe already for 3 years. Now we've been living in Europe for 10 years, and there have been 4 international moves during that time. And what was missing, what is still missing for me, is that thread, because you move countries, you move doctors, you move health systems, but you're missing that common thread of somebody who knows you, who's been with you through your ebbs and flows, and who understands what it is that you need holistically, who understands your medical history, who understands where you are emotionally and mentally. And that truly is a health coach. That is somebody who is in your corner, that is a mentor, that is a partner, and that is somebody that can guide you along the way to your health and wellness goals, right? Because we change as people all the time. Our needs change, our wants change, and it's not up to somebody to tell us what we need. It's somebody to guide us on our own personalized journey. So having gone through my experience, and this is a really long-winded way of me telling you how we got here. So having gone through my experience, I realized that I wanted to become a health coach. So I became one. I wanted to practice with my own clients, wanted to have my own little practice. That's how the YourCoach.Health was born. The .health domains just came around. So it was going to be like you're a health coach, right? So YourCoach.Health. And then I quickly realized with the help of my husband that I cannot be running my practice by pen and paper and emailing and faxing, because people were still faxing and people still are. You guys are in the field, you know how cumbersome that is, but that's still happening. And I created this practice management platform for myself as a toy to use with my clients. realized really quickly how many more people we can help and how many more people could be using this platform. And that's how the idea of Your Coach was born and what it is today. So it started as a pure practice management platform. We have over 2,200 health and wellness coaches who are practicing on a platform. But what we also do is we provide new opportunities for these coaches. The mission of this company, the mission of Your Coach, is for the projected 8.5 billion people by the year 2030 to have access to health coaches. And how do we do that? We match verified, practicing, validated coaches on our platform. And these are coaches who are practicing with their own clients. We match them with our clients, who are companies who are looking for health coaches for their talent, their members, or their clients. So that's really quickly what we do, where we came from. And I would love to show you a little bit what our platform does. So the platform is on mobile and desktop. We developed mobile first because everybody was always on a move. And then the pandemic hits and everybody's in front of their computers. So we really, really quickly realized that we needed to create a desktop version as well. So it's on both. The combination of using the two together is really the best way to go about, just because you can do the more cumbersome tasks on the desktop, but then communication with your clients and your patients can be done on the mobile device. We have a really rich client onboarding process where we'd like to understand what it is that your clients need. We want to make them feel comfortable, and we welcome them to their virtual home, because at the end of the day, that's what we're striving to do. It's a virtual home for you and your clients. So these are some of the challenges that we hear from health coaches. And this is the marketing, it's the selling, it's the client onboarding, setting up programs, support, managing payments. And a lot of coaches are burnt out because of all these processes. So that's why we have all the features on a platform to make it easier. And this is just a quick overview of some of our features. And I would love to go in depth about some of them to help you understand how we help you coaches and therapists go from onboarding your clients all the way to helping them reach their goals. Because outcomes, this is the reason why we're all here. It's all about client outcomes. It's all about making your patients, your clients, to having them feel their best. We have a scheduling tool and availability. So once you set up your programs, your clients can go right ahead and they can schedule the time with you right within the platform. If you want to do an initial consultation, like a free consultation, you can do that as well. You can just set that to 15, 30, 45 minutes, an hour, and your clients can book that as well, your potential clients, before they start working with you. We have short and long-term goals. And I find that this is probably the most important feature that we have on the platform, is because you set these goals to help your clients get to where it is that they need to go, but you also need to see where they're going meanwhile, where they are at the time. So we have the long-term goals, and this is something that they want to reach at the end of their program with you. And we have short-term goals that you can set with them together, or they can set on their own. And this is something that could be, again, short time, 3 days, 5 days, 7 days. You set that and you track them. And we have like a really fun gamified system where they check it off. They get like a little good job message from you, right? So it's very interactive. Everything that we do on a platform is for you to be able to interact with your clients in order to make sure that that you're helping them, because at the end of the day, that's why we're here. That's why they're working with you. That's what they're signing up. One thing we realize, people are so desperate these days because of everything that's going on, and they're just looking for help wherever they can get it. And it's a great responsibility as a platform. It's a great responsibility as coaches, as therapists, that we have in order to deliver the best care to these people who are willing to put their lives in your hands. We have a library of materials that you can share with your clients. So here you would put, for example, exercise techniques, or some books that you want for them to read, or maybe some prompts if you want them to journal. I mean, the possibilities are endless. This could be videos, this could be images, and you drip this to them So you set up your program in the beginning, you just set that up on the platform. Whenever your client joins, you decide when those materials need to be dripped to them. So you can set that up in the beginning of your program, you can add it throughout the program, however you want to work. But everything we do is to just get away, for you to get away from that busy work, because nobody wants that busy work. Most of your programs, if you have individual clients, the framework is most likely the same. So you set that up in the beginning. And also, I didn't mention this, but you can run group and individual programs on the platform. So it's very flexible to whatever it is that you need to do. We also have co-coaching. So I know a lot of you here, most of you are therapists. So we never want you to feel that you're alone or that you need to refer a client out. If you have some coaching certifications as well, that's great. But for example, you want to work with a dietitian because that's what your client needs, or you want to work with a sleep coach or just somebody who specializes in mental health, you can reach out to other coaches on a platform. And we have a great community tab, which is visible just to professionals, which is visible just to the coaches on a platform. Your clients never see other coaches. It's just for you. It's just for coaches. And you can reach out to any of them. And if it's somebody that you want to work with, if it's somebody that you feel that it would be great to run a program together, you can absolutely connect with them and you can create a program. So you no longer need to refer your clients out so they leave and you never see them again. You can actually co-coach them together, which the users on the platform seem to love it. And this was actually one of the first features that we developed and one that I still love the most to this day. We have live sessions. You don't need to leave to go to Zoom. You don't need to do FaceTime. Everything is right within the platform, and you can schedule those and your clients can schedule those as well. Chats and voice notes, again, everything is within the platform. Asynchronous voice messaging, chats, you can send images to each other. You can send questionnaires via the chat, which is something I'm going to get to in a second. So it's all the familiar tools that you're used to, but they're all in one place. So you never need to go anywhere else for health coaching. You can go to other places, right? But this is for coaching without all the noise. This is for working with your clients and patients without all the extra noise. Client notes, which you can leave after your sessions. You can leave notes about your clients. These are just for you. Right now, they're not to be shared with clients, but one of the upcoming features that we have is something that you're going to be able to share them with your clients as well. We have a toolbox of digital tools and therapies with progressive partners that we work with. So this is right now we have Happify and Happy Tech, Licatine, Health Tunes in there. And this is something that you can use for yourself to make sure that this is something that you love. And we worked out codes and deals where you can just use it as a coach for yourself. And if it's something that you love, you can obviously share that with your clients as well, because these are all wonderful tools that can help your clients get better and get to their goals. We have interactive forms and questionnaires. So we have a template on the platform, but you can also create it from scratch. You can use any of the questions that we offer you, and there's about 90 questions in there, or you can create one. And again, these are forms and questionnaires that are sent within the platform. The client fills them out within the platform. You don't need to look through your email. You don't need to worry about where they were sent to. Everything is all in one place, and you can always go back and you can reference it and you can see what's going on. One of the things that I truly believe in is that you should never be penalized for doing what you love. And there's a lot of platforms out there and other tools where the model is, and this is the model that we're used to, that the more you use something, the more you pay. The more clients you have, the more you pay. The more storage you use, the more you pay. So we just turned that upside down on its head. I truly believe that you should be rewarded for doing the work you love. So with our platform, the more you practice, the less you pay. So everybody who comes on a platform, they can work with 2 individual clients and 1 group program for free at no cost. At a point that you sign on your 3rd program, your 3rd client or your 3rd group, you start paying, right? But during the time that you practice already, you start accumulating these points. And these points are for anything, for accepting payments, for creating tasks, for publishing your programs, pretty much for everything that you do on a regular basis anyway. And you start accumulating these points. And the more points you accumulate, obviously the price of the platform goes down. So after your initial clients, you never end up paying after those free clients. Everybody who starts with the paid platform, they're already around $30 or $25. So nobody pays that 40 or 35 because you're ready at that point. And the more you practice, you can get the platform down to just $10 a month, which I think is a wonderful gift because you get to do what you love, and we get to help you do what you love. We have a lot of perks and opportunities that are available to coaches on our platform. Like I mentioned before, we work with our industry partners to deliver health coaching to their clients, their members and their talent. And this is powered by Your Coach. This is powered by us. So some of the perks and opportunities that you get on the platform is, of course, to be featured on our social media. It's early access to our events and VIP features. Our events like the symposium that we just ran for 3 days, and we did not charge anything for this event for our community. And we brought just speakers from all over the world, just amazing, amazing talent. And then the two perks that coaches get really excited about is new client opportunities. And these are individual opportunities and long-term opportunities with our corporate clients. And again, for this, all you need to do is practice with your own clients in a platform. And if you want more work, we have more work for you. The reason we have this as a perk is because before we match coaches or therapists with anybody that our clients are looking for, we need to make sure that you truly know your scope of practice, you truly understand what you're doing, and you're helping patients. And we do that by algorithms on our platform who are constantly running in the background and analyzing. And as long as you understand the scope of practice, there's no good coaches and bad coaches. Just because somebody gets an opportunity, it doesn't mean that somebody else doesn't. It just means that you're not yet matched with that client who is looking for what it is that you can offer. So as long as you're a great coach, as long as you understand the scope of practice, there's opportunities for everyone. And these are not cold calls. These are actual clients that we match you with. We convert your current flows no matter where they're from. So if you're using a lot of different tools, just reach out to our team, and that's team@YourCoach.Health, and we're more than happy to do that for you. And then one of the most amazing things, and this is something that I'm super proud of, is we have a really, really vibrant community. We bring events to professionals all the time, and this is to help you level up your practice. This is to help you level up your knowledge, and this is with marketing professionals and legal professionals. Again, we don't charge anything for the events. We have at least one every month. We also have a community on the platform. We have a community manager that hosts regular meetings and book clubs and is there to truly, truly help you. So I think this is the quickest I've ever run through what it is that we do. So I'm super excited to be here and to talk to you today and to answer any questions. Thank you for listening. I really appreciate it.
Thank you, Marina. Each time I get to listen to you talk about your work and what you've built with Your Coach, it blows my mind. You know, you've really put in, and you could tell the passion that you have behind this. But what you're building is really solving these needs that are out there in the real world when we think about what's wrong with healthcare today. And I think, you know, as we move into the next part of the conversation and hear from Carolyn, you know, you're going to see just how, you know, a woman like Carolyn is building a program that is, you know, that I know I have loved ones who take part in it, and it's that disconjointedness that happens right outside of that. And what you're building, you know, is bringing that community together, you know, through the power of coaching. And, you know, I think that it's really important stuff. And, you know, I'm just, again, so happy to see what you've built in the short amount of time. What feels like a very short, I don't know if it feels the same for you, but it's amazing.
Startup years, you know, it's startup years, so it doesn't really count, you know, but who counts time anyway?
And I'll just add that I think I just listed 3 new features since the last time I listened to you present. So that's just, it's very exciting. Thank you for sharing your deck.
Thank you, and thank you for having me. And just, I wanted to say one more thing, because I feel like I've just been talking a lot, but we're very transparent about what it is that we do on the platform. So we hold monthly town halls where we talk about where we are and where we're going. And we really truly listen to the community. And if there's something that is not working, or if there's something that we can make better, we truly listen, and we go back and we have meetings with the team all the time. And it's not just the exec team, it's not just the business team, it's everybody, it's the developers, and we're all sitting around and we're talking about it. Who is at the end of this? Who are we helping? And who are the people that we're helping, right? So everybody needs to understand the impact that we're making. Everybody needs to understand the DNA of what your coach is. And at the end of the day, if we're not making an impact, we're doing something wrong. So we just need to go back to the drawing board.
Well
I'm
said.
done
Well
talking
said.
now. So I would love to hear what Carolyn has to say.
So now I think, and some of you folks in the audience, you might be sitting back and saying, wow, amazing technology. You could, when we think of health coaching today, what kind of when we think from a clinical perspective, what are the challenges when we're thinking as we're sitting in the neuro edition of this event? What's unique about that neuro population that we need to consider if we're going to be able to bring this type of technology, this type of service, this type of coaching model into a neuro-based population? So that's why I'm super excited to bring a close friend and newly doctor to the stage, Carolyn Brown, who is the founder of Stroke OT. And she'll be talking to us today really about kind of how she's built from the ground up a online exercise program through the pandemic, and kind of what's on the horizon as we think to try to drive evidence-based coaching into the neuro population. So with that, I will start sharing my screen and let Carolyn take it away.
Great, thank you, Mike. I'm thrilled to be here. I'd love to just chat a little bit about the background of Stroke OT and how it became. I've been an occupational therapist for 27 years. I specialize in neurological rehab, working in inpatient and outpatient rehab settings. In 2017, I decided to go back to school to get my doctorate. Primarily because I just wanted to be an agent of change. I wanted to see what else could I do to help the neuro population. So my capstone research when I was in the doctoral program was exploring healthcare disparities in the stroke population. And this is where the seeds for Stroke OT was planted. Stroke OT is a Connecticut nonprofit social service organization. It was created to fill a gap for community stroke and brain injury survivors who experience healthcare disparities. These include the uninsured, the underinsured, those at high risk of secondary complications such as falls, contractures, and those without transportation. So it was created back in 2020 by myself and two of my occupational therapy fieldwork students. Stroke OT became incorporated as a Connecticut nonprofit in early 2021, and now we're currently in the process of becoming a 501c3 organization. So I'm very proud of where we started and where we are right now. Stroke OT has become an online community that offers long-term support after a survivor has been discharged from traditional therapy services. So as we all know well, stroke and brain injury recovery continues throughout a lifetime due to neuroplasticity. So to support this fact, we offer free weekly telehealth exercise and mindfulness groups to Connecticut stroke and brain injury survivors. We also have a website, strokeot.org, with stroke-related educational content and registration information for our telehealth groups. Our three main education topics for Stroke OT is health, exercise, and lifestyle. And why we call it lifestyle education is primarily because we've modeled it after the University of Southern California's lifestyle redesign model, which is known to be proven an evidence-based model for addressing lifestyle changes after injury. We've adjusted that model for the stroke and brain injury population, and we share that education on our website. We also regularly post stroke-related educational videos on our social media accounts. Stroke OT is run purely voluntarily. I can only do this through the help of my level 2 OT fieldwork students. They cycle through each semester. I have one student each semester, and it's been an incredible experience. Every student brings a different perspective and a different type of an area that they're interested in specializing in. Some focus more on motor rehab, and some are more interested in mental health needs of stroke survivors. So it's been an amazing experience. I'm proud that we are working on becoming a 501c3 organization. And I'm proud that we've worked from the ground up through this process. I have an 8-person board of directors, which is a fantastic group of people, and I'm proud for that. One component of stroke OT, and I felt strongly about, is to look into research particularly on how to adapt one-on-one individualized in-person OT interventions into telehealth group interventions. The first ideal research that I conducted was based off of the lifestyle redesign model. I took a standard model that was used for the elderly population and completely adapted it, turned it upside down and adapted it for the stroke and brain injury population, and came up with kind of an 8-step group intervention that brought individuals along the process of pretty much from the moment they had their stroke to living independently in the community. I did an outcome measure based off of that model, and it was found to be effectively used for this population. Satisfaction levels were very high, and it improved health-related quality of life, as well as one's ability to improve their health literacy. The second research that I'm currently looking into is occupational performance coaching. So occupational performance coaching is a practice model. It was created in Australia by an occupational therapist, and it's used quite often in Europe, and obviously it's expanded to the US. The core principles of the occupational performance coaching model is that people learn, develop, and grow doing things that they value as fully as they wish and are able. So this can be something as simple as putting on your shoes, to brushing your dog, to driving across the country with your spouse. So occupational performance coaching has been done through the provision of individualized emotional support from an occupational therapist, primarily because the patient takes precedence in setting small weekly goals, analyzing the problems that prevent them from reaching their goals, and deciding what actions need to be taken, and then evaluating their success of those actions. In the past, the majority of research has been done on the pediatric population, but it has expanded and is starting to be researched on the stroke population. So the efforts are made in occupational performance coaching to develop a patient's self-efficacy and problem-solving skills to manage participation challenges. The coaching model has been well researched, like I said, in the pediatric realm. but we're interested in how these individualized occupational performance coaching methods could be translated into a telehealth group format with one therapist presiding over 3 to 4 patients. Could emotional support from other telehealth group members with a similar diagnosis influence goal setting and acquisition? Could working as a team toward each other's goals influence the outcome? And can telehealth occupational performance coaching be used in conjunction with more traditional telehealth therapies? So we're in the process of conducting a 12-month randomized controlled trial to explore the feasibility of this coaching model and whether it can be effectively used along with cardiovascular exercise, which is more of a traditional telehealth intervention, and whether this model could be used to reduce the symptoms of post-stroke fatigue. So we hypothesize that this model could be successfully incorporated into a telehealth group format. And I really hope to expand the stroke OT groups to use this model in the future. So that's primarily the stroke OT and what we're doing in a nutshell. And again, thank you for letting me share sort of my passion, my love, and what I stay up till midnight working on every night outside of my full-time job.
Well, you nailed it, Carolyn. Thank you so much. And now we'll move into more of the kind of roundtable discussion a bit. And I think there's so many parallels, that we've just gone through, both that, from Marina's side, the power of your technology obviously is helping scale, the health coaching field. And I think we've seen, through what Carolyn's discussed, some of those challenges that arise, for especially, in the nonprofit space, but, primarily for therapists trying to really drive change to a population that's underserved. But what's also unique about the two of you especially is that you bring the perspectives from both the patient as well as the client end, right? So I'd like to maybe talk briefly about, what you're building and kind of, that perspective as we're building things and as we're looking for, evidence-based, practice of what you're building and kind of the passion that you put in it. How do you think you guys have kind of leveraged that patient experience into what you're building today? And maybe Marina, we could start with you.
Sure. So for me, actually being a patient, I realized how a patient, and I hope this comes out the right way when I say this, how a patient is treated as just a patient. Because I feel that we're so much more than that. Being sick, having cancer was just part of my life. It wasn't my whole life. It wasn't the only thing that I was about. There were things that were just as important: raising my kids, being a good wife, being a good daughter, being a good, just a good person and a good friend at the time, right? And just going through my life and exercising and taking care of myself and just taking care of my mental health. But I was just treated as a patient. People who knew, and there were very few because I didn't share my journey with many, all they wanted to talk about was cancer. And I spent so much more time calming them down and telling them that I was okay than worrying about building myself up, right? So in creating the platform, that was one of the main things that I took away, that a person needs to be treated holistically. And if somebody wants to be treated as a patient, and we have days where we want somebody to just worry about us and to think of us and take care of us, sure, that's something that can happen, but it needs to be driven by that person. So in building what we're building, my goal, my thinking is always, what is it that the client needs? And that's why whenever we talk to coaches, we want to make sure that their clients can appreciate what it is that we're building, that it's comfortable for them, that this is where they feel that they can share what their goals are and how they want to be treated. If they want to be treated holistically, if they want to be treated as a patient, if they want to just be treated, like talking about one aspect of their life. So to me, that was the thing that I took away the most, that you really truly need to listen to an individual and not assume that you know what it is that they want. Just like I can't assume that every other cancer patient doesn't feel like just a cancer patient. I can't assume that that's because that was my experience, right? So I think, I guess that's what I'm trying to say in a very like long way, is to truly listen to what that person needs, truly listen to what the patient needs and what they want to accomplish, not what we think they want to accomplish, but what they want to accomplish.
I completely agree. I think the medical model, especially in the United States, sadly, Medicare covers individualized therapy, one therapist in person to one patient. And I feel that a community is so needed for especially people who are immediately after their stroke or their brain injury. And we therapists don't do a good job, especially some occupational therapists, we don't do a good job taking a holistic view of rehabilitation, especially in a hospital setting, because it's such a medical model. It's viewed as a patient. It's viewed as these are their sets of goals to get them discharged and out the door. And I just, especially now creating these groups, of course, none of these groups are billable through Medicare. It's not something that can be incorporated into a hospital system, but it's too bad that that it can't be, because it just seems so important to take all areas of a survivor's life into consideration when assisting them throughout the rehab process, and not just addressing what the patient needs in order to get out the door.
Yeah. I couldn't agree more. And I think it's because we just don't spend enough time educating the professionals on how to take that holistic view. It's not because they don't want to do it. It's not because they have no interest. It's just there's not enough education out there. And, to bring it back to health coaching for a second, the health coach was just recognized as part of essential health and care team. And I think that's the only way that we're going to be able to accomplish that holistic 360 view of a person, is by working together. Doctors are important, therapists are important, nurses are important, health coaches are important. It's all of us creating that community, creating that team to understand what it is and how it is that we can help that individual.
Mm-hmm. Absolutely.
Yeah, you both bring up really great points there, and we've had each you on individually on our podcast, and got to dive a little deeper into both your why, and it's what you just mentioned too. 2 points, for Marina, when you mentioned about what you're seeing of Marina, just you didn't want to talk just about what was going on with your diagnosis, but you wanted to be seen as a whole person who still had a young family and had life goals and wanted to get back. And I remember on your podcast talking about you just wanted to box. And to me, that was like, I was like, yeah, there is, this diagnosis aside, you wanted to get back to doing what empowered you. And, and to your point, Carolyn, as PTs and OTs, we talk about functional goals, and we talk about getting someone out the door so that we can complete our episode of care and say they're safe to get out the door. But what's missing from that is what we talked about with bringing together, the theme of this discussion is about bringing digital tools and digital transformation and rehab. And a lot of what we talked about over the weekend in this conference is about high tech, but the coaching can also bring in the high touch, or that personal component that often is missing. And with, the term often is used like building that bridge to wellness. And I think that coaching component is what really comes in. If we're going to build a bridge, there's a lot of rivets and there's a lot of components to hold that bridge together. And at different points, we need a team approach, and that may be clinical and skilled, and it may be non-clinical, but very skilled in that behavior change and giving those nudges. And I think both have a very valuable component to bringing more of that holistic care component that you mentioned, Marina, to to the in this case, into the full rehab picture. So thank you both for sharing. And I think it's exciting to hear, both of the work that you're doing, how things are really developing. I can see us kind of, as we further these discussions, helping and expose more clinical folks and also non-clinical folks to the needs in both communities.
Yeah, I mean, what we're building is the operating system for behavior change that's powered by health coaches. So it's still human-led, but it's tech augmented. So tech is there to help, it's there to guide, but it's the human touch. We all want that person in our corner and a person to talk to and to help us.
I'm going to call out Lauren, because that's almost what I wanted this to be titled, Technology with the Human Touch, right? And that's what it is.
We didn't even
Well
talk
said.
about this, right?
We didn't, no. But no, you're right. And maybe when we think about that human touch, Carolyn, let's dive, for a couple of minutes here. What's unique about the neuro population when we think about this coaching model? What are the considerations that we need to think about to really be able to make this happen?
Oh, goodness. So you're talking about a population with, especially stroke, with such diversity in age, such diversity in symptoms, aphasia, communication deficits, frontal lobe damage with cognitive deficits, visual deficits that could impact the ability to, say, read an app or look on the computer, mobility deficits. So I think the biggest challenge ideally is kind of adapting a coaching model to meet the needs of a diverse population. I find even in the stroke OT groups, I've had to adapt how information is given during the groups. I've had to adapt how emails are sent, because some folks have difficulty even reading the email, understanding where to click on the link to join the groups. Some folks have a lot of difficulty even understanding how to turn their volume up and down. I mean, these are things that I can't be next to them to teach them how to do. So I think it would, the biggest challenge I feel sort of come from the end of making the technology be accessible for people who have such a diversity of deficits, and particularly the communication, the folks with aphasia, So I think that would be the biggest challenge, but I feel like the tech world is up for that challenge, and I think that it can happen, but it would take definitely some trial and error with focus groups.
Yeah, and also takes people
challenge accepted. Challenge.
Okay.
And there's some brilliant people, who might be in the audience right now, as a practicing therapist. I know we've had sessions, in the past, and one of our past podcast guests was it kind of came from the OT world, moved into technology, worked with Microsoft, and a key part of their accessibility team. So, I think it takes folks like yourself, Carolyn, and other people in the audience today who kind of have that therapist lens, understand the patient perspective, kind of help these technology companies, really scale. And I'm sure, like you said, Marina, you're up for the challenge, and you will, exceed in that. One thing I wanted to touch on, and maybe, as we come to the end of the discussion, there's certainly a lot of therapists in the event today who are going to be thinking around, how do I build this type of coaching into my practice? But there's also, CEOs, there's companies out there that are building very, neuro-based products, but want to maybe think about how partnerships in the behavior change space happen, right? Because if we look at other companies that are out there, in stepping away from neuro, particularly, think of Omada Health, Livongo, they've built these technology companies built on behavior change. So how would you, maybe suggest, for these companies to start thinking about incorporating health coaching and behavior change? Because sometimes people think, oh, I'm going to bring a health coach in to grow, my user base and help with engagement, right? But that's not really the case. So maybe take a couple minutes to talk through that and how you're working with some of the therapeutic companies that you have on the platform.
So I'm a true believer that everybody should be doing what they're best at. That's everybody's forte, right? So these companies, they're amazing at what they do. The companies that you mentioned, and there's a lot of other digital therapy companies out there, and they're amazing at the product that they've built and the self-paced care that is delivered to the users, or care that's augmented with professionals. We believe that health coaching should surround those therapies, and this is what we do. I can't reveal it yet, so stay tuned for a really exciting announcement that's coming from us in the next couple of weeks. But we just signed our first contract with our go-to-market partner, where we're going to be providing all of the health coaching for this digital therapy company that is very familiar and very well known to most. The health coaching should surround the offering. Health coaching on its own can't work. The therapy on its own can work. I think it can, but just not to the full extent of what it is that we can offer when we work together. So the way we work is it's powered by YourCoach. This is their therapy. This is their product. This is their offer. And it's powered by the gig economy of health coaches that are practicing and verified on the YourCoach platform. So I think we're stronger together. I think we should be working together. And I think everybody should be doing what they're great at, because that's the only way to scale operations. And that's the only way to bring it to market the way that it needs to, that it needs to happen.
Yeah, I feel that health coaching really could, especially it's a financially viable option for especially the number of people who are underinsured. These are folks that have $40 copays per therapy visit, have a $3,000 deductible per year, or have 8 visits of in-person therapy approved per year. It's people need the next step, and health insurance isn't going to change as far as what they're going to cover. So if health coaching could fill that gap, it would be incredible, because it would be addressing a need for a large majority of the population who have limited insurance coverage. And it's an affordable way to do it.
Go ahead, Marina.
Just one point, so speaking of insurance, category 3 CPT codes were approved for health coaching. So they're in a process of being tested right now by the AMA. So super excited for what's to come in the next couple of years when it is covered, and we're working on the platform. We're going to be ready for it once it is something that's approved. So exciting times. I think we're having these conversations at the right time. We're on precipice. I mean, even though health coaching has been around for over 20 years, I feel like now is the time where this revolution is taking place and truly is taking off.
Couldn't have said it better. And, with that, I think it's, the importance of what we were discussing with Carolyn, how do we then bring this to the neuro population, those special populations that need that extra attention, right? And it's going to be hard work, but I think with folks like yourself who are leading, Marina, on the technology side, really powering this from reimbursement and all angles, to bring this coaching to, like you're saying, a revolution that's on the up and up. So it's exciting, and then it's going to take the clinical side and the research that Carolyn's doing to really drive the evidence behind what we could do for, specifically in stroke, but as we look for other neuro populations as well. So, I think it was a really exciting conversation today. On the podcast, I always let David, kind of do the outro here. He's got the podcast, the host voice is what I think it is.
It's all on the mic. Mike, you have to get low to the mic. No, I just want to thank you both today for joining us and really helping to dive in and helping us truly build a case for, you know, the team coaching approach that's needed, especially in neurological care, which is the theme around this edition of the summit here that we're at. And I know, Marina, you probably perked up a lot of ears with our PTs and OTs just because you figured out how to ditch the fax machine. And so that's a start. So for anyone who wants to get back with you, it's YourCoach.Health. And for Carolyn, the great work that you're doing and the evidence-based and the research that you discussed today as well, strokeot.org, correct? .org. So I'll keep it brief, but I just wanted to thank you for really enriching the discussion today. And Mike, that's all I have. I've got a patient in the wait here that just popped into my virtual my room. So I think with that, I'll just say thank you, and I'm very grateful for having this discussion today.
Thank you both.
Thank you so much. It was lovely. It was a pleasure.
Thank you, guys.